Welcome to Medcastplus. I am your host, Dr. Braha. On Medcastplus, we aim to bring local healthcare providers and physicians to discuss important topics relevant to our health and well-being. Today, we welcome Dr. Joseph Rahabi, a local dentist specializing in family dentistry. He takes care of people of all ages here in Brooklyn. It is important to have a dentist on our show. As you've seen in previous episodes, one of our cardiology friends, Dr. Mitchell Lipton, spoke about the importance of dental health and how it relates to our overall body's health, including our heart. Welcome to the show, Dr. Rahabi. It is so great to have you here because people take care of their teeth every day. They brush their teeth. In my practice, they ask me all the time about dental health. And here we have an expert in family dentistry. Welcome.
Well, first of all, thank you so much for having me, Dr. Braha. I appreciate the opportunity. Yes, I practice here in Brooklyn, New York, in Sheepshead Bay to be exact. For me, it's an opportunity to connect the dentistry with the medical aspects of the total body health and so on and so forth. So yeah, we do in our practice emphasize proper oral hygiene, and we constantly try to educate the patients in how if they take care of their mouth, it'll give them a better general health experience.
Right. Overall, you know, when patients see their doctor, they focus on blood pressure, they focus on their EKG, their hearts, they talk about all different things like cholesterol. And one of the parts of our health that I think maybe gets looked over often is dental health. Maybe we take it for granted. You know, we pick up our toothbrush every morning, every evening, we brush our teeth and we move on. But as you said, it really is connected to the overall well-being.
Exactly. Well, I try to educate the patients into, for instance, proper oral hygiene and plaque removal. And we have actually spoken to patients about how there have been studies that show that patients that take care of their mouths at a higher level tend to have even a higher life expectancy. Now, they're not sure if those results are partially anecdotal, because people that take care of their mouths tend to take better care of themselves. So at the first visit, we usually try to educate the patients in proper oral hygiene techniques, of course, after we've done a proper clinical and radiological examination. And then we'll make it a point with each patient to sit them down with toothbrush and dental floss and teach them in how to properly take care of their mouths. Now, a lot of people think that they know how to brush and floss properly, but you'd be surprised that 90% of the time the patients don't. So we do spend the time with them, and they're happy that we do, and they appreciate it.
So tell me a little bit about yourself. How did you get into dentistry? What does it take to become a dentist? College, dental school, how long? And why did you decide to do this?
Well, interestingly, when I was a child, I used to, I'm talking about when I was like around age 8 or 9. We had a family dentist. My father was friendly with him. I'd get home from school, and my father would, my father was very old school. He was from the Middle East, and he'd say, go to the dentist. And then I'd go to the dentist by myself. I'd walk about 8 blocks from the house. I would get there. One of the first questions they would ask is, did your dad send money? And I would say no, and they'd say sit down. And he was such a fine gentleman, and the work that he did, some of the work that this gentleman did in my mouth when I was 8 still has lasted to this day, and I'm 56 years old. So he started with him. He was one of the, he kind of inspired me, and it started from there, and I just made sure to get good grades and in high school and college, and that's how the whole thing started.
So how many years is dental school these days?
Dental school is 4 years, and there is a mandatory 1-year residency, which wasn't the case in my time, when I trained, but I did the residency nonetheless. I trained at Columbia University Dental School, School of Dental and Oral Surgery. I did my residency at Lutheran Medical Center. One of the great things about Lutheran is that the residents there have to do pretty much everything, including trauma. So we would have to be there all night sometimes. People would get into car accidents or the victims of crime, and we'd have to put their jaws back together, and and things like that.
So quite a bit of training becoming a dentist.
Absolutely. And it's interesting, to this day, I still feel like I'm picking up some new realms of knowledge and some new techniques. And year by year, things change, and I at least once a week it happens to me where I say, something, I think I could be doing something a little bit better. For instance, one of the things that I've come to realize, and I've been educating the patients about this recently, is that for instance, there are patients that smoke cannabis, and they think that the cannabis doesn't affect their teeth and their mouths as much as regular smoking. But I have found that the patients that smoke cannabis, actually, they can have as bad a result in their mouth, or sometimes even worse than regular smoking.
Very interesting. Yeah, I think in medicine as well, that's why we call it a practice of dentistry or a practice of medicine. We're always expanding on our knowledge, we're always learning, and it's good to hear that. It's important for folks to know that your education doesn't just finish the day after you graduate medical or dental school. We're always looking for the next and best, greatest way of treating our patients.
Yes.
And so moving into treating our patients, when someone comes to you, for example, first visit, they get an x-ray, they get a cleaning, you explain to them how to brush their teeth, they're healthy, they're doing well. What are some of the parts of education that you teach them of alarm features, things that they should look out after this first cleanup, this first checkup? What should they look out for that should tell them, I need to get back to the dentist sooner?
Well, there are a couple of things. First of all, are you comfortable? Are you chewing properly? Are you feeling any pain or sensitivity? Are you noticing any blood in your mouth? Do your gums ache? Things like that. If you're feeling any of those things, then obviously you should be seen. Interestingly, a lot of the patients, they tell me, well, I don't floss often. Why is that? Because the flossing makes my gums bleed. So I tell them, well, if that's the case, you actually need to increase your flossing, not decrease your flossing. And often the reason that their gums are bleeding is because they're not flossing correctly. So the education part of it does come into play there as well. And interestingly, now that you brought up the subject of the gums and the gingivae, the healthy gums are extremely important, not only in your mouth, but also systemically. Because in your gums, you have small blood vessels and capillaries. And when the gums become inflamed, you can have bacteria, which is in your mouth, infiltrating into those gums. And from there, the bacteria finds its way into blood vessels in your heart, and even the carotid arteries that go up into your brain, leading to a higher incidence of cardiovascular disease and even stroke. So the correlation between a healthy mouth and healthy gums and teeth and being healthy generally became pretty more relevant starting about 15 years ago, and they're doing more and more research about it to this day.
So after that checkup and the obvious incredible education that is important for patients to get regarding gum health relating to their overall well-being, when should they follow up again if they're in good dental health? When's the next visit scheduled?
Well, that's a very good question that you brought up. Most recently, I would say within the past 5 to 7 years, I'm recommending to patients over the age of 40 that they be seen for a dental checkup and a regular, like we call it a deep cleaning, where we clear out the gums, do a curettage of the gums, and clean the teeth. We are recommending that be done every 3 months. I myself get a deep cleaning every 3 months and have my gums cleared out and checked. For instance, in my family, unfortunately, many of my uncles both here in the United States lost many teeth because gum disease tends to run in my family. But if you get your checkups, if you get proper dental cleanings, if you're doing your cleanings every night at home, you can forestall a lot of the problems that people think are imminent or it's a given that you're going to have it because your parents had it or something like that. In other words, it can forestall the genetic component to, let's say, having bad teeth or bad gums.
So even though many people in the family have this problem. The genetics are there. We can't change our DNA, but seeing a dentist frequently, as recommended, can help push off maybe the problems that dad or grandpa or great-grandpa had in the future.
Absolutely. And for instance, like when we get patients who are pregnant coming in, a lot of patients who are pregnant feel that they're going to automatically have bad teeth and gums because of the pregnancy. But getting your teeth assessed by the dentist and getting proper cleanings and treatments that are necessary can prevent something called pregnancy gingivitis and other problems that can happen with the teeth during pregnancy. What's interesting is that what I almost like a recording, a continuous recording to the patients, is how we emphasize. I always tell the patients, I need 5 minutes from you a day, but I need those 5 minutes right before you go to bed. Proper brushing, proper flossing, and rinsing with something like Listerine. For instance, the way that it works is you brush, which removes the gross debris. The flossing removes the bacteria and the plaque that's built up in between the teeth. And the flossing also kind of opens up your gums just a little bit. And then something like an oral rinse, such as Listerine, delivers say a final knockout blow to the bacteria.
So I like that. 1, 2, 3 for 5. So 1, 2, 3 for 5 minutes.
Absolutely.
So 1 is the brush, get rid of the big stuff. 2, floss, gets rid of some of the micro debris or stuff stuck between the teeth. And then the Listerine is kind of like the rinse and repeat type when you're washing your hair, gets everything out of there.
Right. Well, the bacteria doesn't. The bacteria is a lot of the bacteria is killed by the alcohol in the Listerine and some other medications that are in the Listerine. So, by the way, I don't have any type of a arrangement with Listerine, but
there are many brands out there.
Yes, exactly. There are many.
Now, do you dilute it a little bit? Do you wash it with a little bit of water? That's what I used to do. That's why I'm asking.
I don't recommend that the patients dilute it. Additionally, I always tell the patients, rinse with the Listerine for 60 seconds, spit it out, and then don't rinse with water afterwards. Allow the Listerine to kind of linger in your mouth and to continue to provide an antibacterial action. Interestingly, I tell the patients, before you go to bed, you have 2 choices. You can either service your mouth for 5 minutes or not service your mouth. If you service your mouth for 5 minutes, you can get repair while you sleep, okay? Because then what you're going to get is remineralization. There are minerals in the saliva that can be protective. However, if you did not service your mouth, then the opposite can happen. The bacteria that's already in your mouth and and will metabolize the foodstuffs that are in there and cause the buildup of plaque, which can cause inflammation in the gums. And once you have inflammation in the gums, you can get bacteria infiltrating into the blood vessels in the gums and causing problems not only in your mouth, but elsewhere in your body as well.